What is major depressive disorder? Major depressive disorder is a mental disorder where a person has intense feelings of hopelessness and begins to withdraw from life in a number of ways. This can include losing concentration and energy, as well as a change in appetite and sleeping patterns. Approximately 1 in 5 people will experience a depressive disorder throughout their lives, with major depression being the most common.
Vortioxetine is an antidepressant that was TGA registered in March 2014 for the treatment of major depressive disorder in adults, as well as being used to prevent relapses. Vortioxetine has a multimodal mechanism of action. It selectively inhibits reuptake of serotonin, and it also acts as an agonist or antagonist at serotonin receptors directly. Side effects. Over 10% of patients experience nausea while taking vortioxetine, while less than 10% experience diarrhea, dizziness, dry mouth, and constipation. Using this drug may also cause weight gain, like with many other antidepressants. Potential interactions can occur with other medications that affect the serotonergic pathways. There is an increased risk of serotonin syndrome when combined with other antidepressants such as SNRIs, SSRIs, TCAs, MAOIs, fentanyl, lithium, and other antipsychotic agents. Vortioxetine can also cause abnormal bleeding, so caution must be used if patient is also using warfarin or aspirin. It is also important to note that vortioxetine is a pregnancy category C drug. It is administered orally and absorbed via the gastrointestinal tract, with peak plasma concentration at approximately 7 to 11 hours and an elimination half-life of 66 hours. It has linear dose-proportional pharmacokinetics, with a steady-state plasma concentration generally reached within 2 weeks of once daily dosing. The drug's exact mechanism is unknown. Vortioxetine is pharmacologically different from other selective serotonin reuptake inhibitors because it also works by direct modulation of various serotonin receptors. Preclinical studies suggest that vortioxetine's antidepressant activity may be a result of the drug modulating neurotransmission in multiple systems, including serotonin, norepinephrine, dopamine, acetylcholine, histamine, and glutamate, thus regulating neural networks involved with mood disturbance established in MDD.
Vortioxetine is a serotonin modulator that is used when symptoms of depression have not improved whilst on first-line drugs, thus considered an atypical drug. Citalopram, paroxetine, and sertraline are among the most commonly prescribed drugs effective in the treatment of depression, thus deemed a first-line therapy. These drugs may, however, cause some side effects ranging from drowsiness to nausea, insomnia, dizziness, dry mouth, restlessness, or agitation. Collectively known as selective serotonin reuptake inhibitors or SSRIs, they similarly function to raise the levels of extracellular serotonin.
Vortioxetine has been researched extensively to observe its efficacy and safety as an antidepressant for major depressive disorder. A 2014 study found that vortioxetine is highly favored due to its less intense side effects in comparison to other antidepressants. The efficacy and tolerability of vortioxetine was again observed in a 2016 study. It was found that vortioxetine had a 6.3% discontinuation rate, while other antidepressants such as venlafaxine and sertraline had significantly higher discontinuation rates of 17.1% and 17.4% respectively. This shows that vortioxetine is the preferred choice of treatment due to its high tolerability among users while still being significantly effective.
Vortioxetine represents an important treatment option for patients with major depressive disorder due to its far-reaching social and clinical impacts. Almost 2/3 of individuals who die by suicide have symptoms consistent with major depressive disorder. Vortioxetine therefore has a major social and clinical impact on the lives of those living with depression. Vortioxetine is also extremely cost-effective and dominates the market when compared with escitalopram, another commonly prescribed antidepressant. This is significant as socioeconomic factors have been recognized as a contributing risk factor to major depressive disorder. Also, vortioxetine distinguishes itself from other antidepressants by improving cognitive function, increasing wakefulness, and lowering the incidence of sexual adverse effects at lower doses. Therefore, it's clear that the impacts of vortioxetine are extensive and its future implications could potentially change the quality of life for patients with major depressive disorder.